Okay. Madam Speaker, to the bill.
To the bill.
Colleagues, as many of you know, I've spent most of my professional career working as an educator in Washington County. I've seen up close and personal how important it is for our children to not only be healthy, but to have access to quality health care. Very simply, sick kids can't learn. We heard in committee that we could exclude school districts from this assessment and it wouldn't make a difference, except we may not be able to, and we shouldn't. First, Oregon needs to be able to confidently submit a plan to the Centers for Medicaid and for Medicare Services for approval. Exempting an entire insurance market raises the question of whether Oregon would need to prepare and seek waivers of certain federal requirements. This creates an extra step in that process, and with this step comes a risk. As co-chair of the Ways and Means Subcommittee on Education, I know that we cannot budget unless we are confident that the money we say we have will not be subject to delay or to correction. For nearly 1 million Oregonians who count on Medicaid to deliver quality, affordable health care, that is a risk I do not believe that we should take. Second, colleagues, I ask you to consider an important statistic. 1 in 2 Oregon children receive their health care through the Oregon Health Plan. What that means in real numbers is that there's nearly 400,000 Oregon children ages 2 to 18 who are enrolled in Medicaid. We also know there are approximately 580,000 students enrolled in the K-12 system. And while we don't have a number today about the number of students who are enrolled in Medicaid, what we do know is that it's in the hundreds of thousands. The success of our public schools is reliant upon the ability of our students to attend class and really be able to learn. This means ensuring that their basic needs, which includes health care, are addressed. Ensuring access to health care begins with health care coverage. And in my opinion, Oregon cannot afford to leave children uninsured because, colleagues, sick kids can't learn. I believe strongly that our school districts have a stake in the funding of a stable and secure Medicaid system in our state. This package includes them in a reasonable and thoughtful way that takes full advantage of the federal funding our state can receive. For the well-being of students and families across Oregon, I urge you to join me today in favor of House Bill 2010. Thank you, Madam Speaker.